Stop It Trial, 2015. How shorter antibiotic courses changed the game in intra-abdominal infections. Hey everyone, welcome back to the channel. Today, we're diving into one of the most influential studies in infectious disease, the Stop It Trial from 2015. Grab your coffee, settle in, and let's break it down. What was the Stop It Trial all about? So, picture this. You've got a complicated intra-abdominal infection. Think appendicitis, perforated ulcers, or diverticulitis. And the big question is, how long do I really need to be on antibiotics after they fix the sores? The folks behind the Stop It trial wanted to know if a short course, just 4 days, could be just as safe and effective as the traditional, longer course that lasts until a couple days after you're all better, usually around 8 days. The study at a glance. Design: multi-center, randomized, double-blind, placebo-controlled. If you love methodological rigor, this one's for you. Population: 518 adults with complicated intra-abdominal infections who'd already had their infection source controlled, like after surgery or drainage. Intervention: short course, 4 days of IV antibiotics, then placebo. Long course, until at least 2 days after symptoms resolved. Median was 8 days. Primary outcome: the big three: surgical site infections, recurrent abdominal infection, or death within 30 days. What did they find? Short course was non-inferior to the long course. Composite outcomes: 21.8% short versus 22.3% long. Statistically, that's pretty much the same. P equals 0.92. No difference in death rates, SSIs, or recurrent infection. Shorter hospital stays. Median 5 days versus 6. P equals 0.04. Who doesn't want to get home sooner? And, important, there was no increase in treatment failures with the shorter therapy. So, what's the big takeaway? Bottom line, if you've got a complicated intra-abdominal infection and the source has been controlled, you don't need more than 4 days of antibiotics. Stopping early is totally safe for most people, helps prevent antibiotic overuse, and probably means you'll be back in your own bed that much faster. Impact on practice: this trial influenced the IDSA and SIS guidelines. Now they recommend shorter courses, usually 4 to 7 days for this kind of infection. Plus, it's a big win for fighting antimicrobial resistance. Less unnecessary antibiotic exposure means fewer resistant bugs down the line. Limitations: because no study is perfect, didn't include immunocompromised folks or people with high-risk infections. Think untreated cancer. Most patients had appendicitis, about 60%. So we need to be a bit cautious extending this to all intra-abdominal infections. That's the scoop on the Stop It trial. If you found this breakdown helpful, drop a like and subscribe for more evidence-based takes on the hottest clinical trials. Got questions or want to hear about another landmark study? Hit the comments below. Let's keep the conversation going. Thanks for tuning in on the Everything Surgery podcast. Dissect the extraordinary.